right, as we continue our trek through the skeletal system, we're going to look at various topics today. You just finished up, hopefully, learning classification of bones, and then we learned a bunch of the different types of bones. You've got your skeleton diagram filled out and hopefully taking your quiz and all that good stuff. So anyway, let's continue on. A couple of bone disorders I wanted to mention at this point before we get into some other topics is one's osteoporosis. You might have heard of this before. It typically affects middle-aged to late middle-aged women, but it can affect anyone. That's just the group that we typically see when they're following menopause. There's a lack of estrogen in their body, and this can cause their bones through various events to become extremely porous and more likely to break. Also, they don't heal as quickly. So osteoporosis, you can kind of see here in the normal bone matrix, say the spongy bone, how it typically looks. It's got a lot of filler area in there, and somebody with, this would be extreme osteoporosis, you can see it starting to bore out. So think about how brittle that would be. It's definitely not as structural as normal. Osteomalacia is another type of disorder, not the same as osteoporosis, but osteomalacia. We hear this called rickets when it's referred to in children, not sure why, but that's what you hear it called. It gives this bow-legged, a lot of time, appearance. So this bow-legged appearance, we see this called rickets, but in adults it's called osteomalacia. This is when the bones begin to soften because of lack of vitamin D and also lack of calcium. So getting those two things, mainly through exposure to sunlight and, of course, your diet, can help cure this disorder. And you can see here that if it bends the legs, if the bones in the legs are the ones that are suffering from it, for example, carrying all the weight of the person may cause those to break. Speaking of breaks, lots of different types of breaks I want us to look at. But first, why not watch a quick video? You may have seen this before. Guy in the ring, not guy walking by. Oh, you want to see it again? Oh, let's watch it again. Ooh. Your legs are not meant to bend that way, in case you weren't aware. This guy broke both legs. Not sure what type of break he had, but let's see if this helps clarify a little bit of it. So there's types of bone fractures. One's a simple fracture. Maybe that's what our guy had. This is when the bones break but don't penetrate the skin. Seeing he has had his skinny jeans getting ready to wrestle, we didn't quite able to see the skin there. But a simple fracture wouldn't penetrate the skin. A compound fracture is when the bone breaks through the skin. We can see that here. It's a very severe break, and also then it punctures through the skin. You got to also think, though, it's also puncturing through muscle, possible blood vessels, nerves, and all that intricate work inside the body. So that broken bone in a compound fracture can be very, very difficult to recover from, simply because of all the surrounding tissues that it gets affected. A compression fracture is when the bone is crushed. It's not really a clean break. It's more like you get crushed by something. Something falls on top of you, and instead of just clean breaking through the bone, it shatters into multiple pieces. An impacted fracture is when bones are forced into one another. So like, say, this could be what that guy in the ring actually had. Say this person were to jump down, and the impact from the bone itself crushing into itself or into another bone. So up into the hip or the tibia and fibula down here could have crushed up into this bone. And as you can see by our little diagram here, there's a lot more than just a clean injury, a clean break injury. Impacted can cause this bone to shatter in multiple directions, multiple fractures, all that good stuff. Kind of painful to think about. If you've ever had an impact fracture or a compression fracture, you know those are not easily set. A lot of times multiple pins and screws, and even sometimes prosthetics put in. So then you have a green stick fracture. This gets its name from if you've ever had like a green tree or a green branch, one that's not really dead and falling off onto the ground, and you try to break it, you know it's difficult to break. You'll bend it and you kind of snap it a little bit, and then you bend it the other way, and eventually you can work it into breaking. But that initial bend just causes it not to break completely. It may just crack a little bit. So that's where we get this incomplete break that we call a green stick fracture. So just like a green tree that you can't break because it's, still alive. That bone, it breaks, but not completely. It just kind of gets some cracks in it. So there's lots of other types of fractures. Those are the main 5 I want us to look at. And with injuries, sometimes you have to have pins and plates put in. You've heard of people like that, or maybe you've had an injury like that. These are just some x-rays to show and what it looks like to hold those bones in place after severe injuries. So let's move to another topic, and this is joints. A joint is the union of 2 or more bones. There are many places in our body where more than 2 bones connect with each other. There's actually 230 joints total in the human body. And you go, whoa, well, I got 206 bones. Correct. But there's 230 joints. So each bone is pretty much connected to other bones other than, I think the hyoid bone in the throat is the only one that's not connected to any other bone. And you can classify joints in several different ways. And let's look at a couple of those. The 3 major kinds of joints. One's a fibrous joint. This is connected by fibrous tissue. There is no cavity. There's no opening. There's no hollowed out area in between this joint. Little to no movement. You really don't want these bones moving. The most common one that we think of is the joints in the head, the fibrous joints in the head. Now, when we're newborns, and hopefully in lab next week, we'll be able to look at this a little bit more closely. But when we're children, when we're newborns, we talk about people having a soft spot or their skull not fully formed. These fibrous joints are not yet connected the way they are when we, mature. But once we're mature, at your age now, and even older, these joints, they're not moving. They shouldn't have any movement. They are held together. If you look at any skull, like a good model of it, you'll see these little cracks inside the skull. The ones in lab we'll be able to look at. These are fibrous joints, so they're held together. There's multiple bones inside the cranium, many bones inside the cranium, but they're held together by these joints. Also down where the tibia and the fibula meet distally, so farther away from the point of attachment, that's a fibrous joint. There's not a lot of movement there. If you like Alabama football, our quarterback last year, he had an injury down here, and they actually had to screw these 2 bones back together. The fibrous joint had become detached, along with some ligament damage and things, but they attached these with pins. So anyway, it's not supposed to move. It shouldn't be moving, or at least very little if it does. Fibrous joint. Cartilaginous joint, as the name kind of implies, it's united 2 bones by cartilage. So there's not a joint cavity here either. So there's not an area in between the 2 bones. Still little to no movement. But with cartilage, it's a little more movable. When we talked about it under tissues, we talked about that. Even like hyaline cartilage and things like that, you can kind of move it around slightly. Think about your ribs and your sternum, so your breastbone here. These need a little movement because as you take deep breaths, your lungs need to be able to fill up and push against those ribs. So this cartilage allows a little bit of movement. And then also in the pelvic bone, we've got some fibrocartilage here that holds these together. The model inside my room has a good look on the cartilaginous joints of the pelvis there. So this needs some movement. Think about with childbirth in females. These will shift a lot to allow the baby to possibly be delivered vaginally down through the hips. So these may expand and even sometimes separate from each other. Yay! We'll talk about reproduction system later on. And the third and final type of joint is the synovial joint. This is what we most commonly think of as a joint. These are separated by a fluid-filled cavity that is filled up with synovial fluid. How about that? Synovial fluid, I think we did mention it with tissues. It is a very viscous, very slippery fluid, and it helps these joints move freely on each other. Okay, they move freely on each other. We've kind of got a basic general structure of synovial joints. Like here, this looks like the knee. I'm just guessing here. Femur and then tibia. We can see articular cartilage on the end of bones. We saw that in our long bone diagram. This is that smooth cartilage that covers ends of bones. Then we have a cavity, an opening here. Remember the other two joints that we talked about a second ago didn't have this. Now we have this opening. There's synovial membranes that surround sacs inside these cavities, and then there's synovial fluid that occupies the free space. So water on the knee, or got to pull, leaky fluid on my knee, or things like that, is where those synovial membranes have been ruptured, and that fluid is evacuating out of the sac into this joint cavity. It's not good for you. You need to have that sac there so your knee or any kind of synovial joint can move freely. I think we're going to end our notes there. Next notes, we'll talk about all these different types of synovial joints. These are, some of them are pretty common, some of them are not so much. So anyway, we'll stop there and we'll have a part 4.